Hi, everybody. My name is Dr. Laurie Zelinger. I'm a board-certified psychologist, and I work with children. My son Perry and I just finished writing a book. It's new for 2019, called Please Explain Tonsillectomy and Adenoidectomy to Me. It's a complete guide to preparing your child for surgery. So if you're watching this video, you may be the child who's going to get their tonsils out, or perhaps you're a parent. So I wanted to be able to read you a script from the book that would give you some idea of the information that was in there so that you could best prepare your child and your family for the events to come. But before I do that, I just want to show you some of my other books. The Please Explain series is being published by Loving Healing Press in Michigan. So I have my new Please Explain Tonsillectomy and Adenoidectomy to Me. Please Explain Anxiety to Me. Please Explain Terrorism to Me. And I wrote this book for American Girl, and that one is a smart girl's guide to liking herself even on the bad days. So let me read you the script that's in this book. The book has a lot of information about how to prepare your child 2 months before, 1 month before, a few weeks before, the day of, what to do during surgery, and recuperation. And it has scripts that can start conversations. So let me just read one script to you. Your child may ask you what tonsils and adenoids are. You can share the fanciful uvula picture on the previous page and say something similar to this. And this is the picture. And I have my big teeth here, and I'll show you what they are in a minute. Lots of parts of our bodies have special jobs. Just like our legs are for walking, our nose is for smelling, and our tongue is for tasting, our tonsils have a job too. We have two of them way back in our mouth by our throat. If we open our mouth wide and look in with a flashlight, it sort of looks like a stage with the lights off before a show. There's a thing hanging down in the middle. Can you guys see that? It's called a uvula, and it's kind of like an acrobat who's hanging from the ceiling on a stage. If we look to the sides, we'll see a pink bump on each side. I'm hoping you can see that, and my tongue that I made out of Play-Doh. And those bumps, are the tonsils. Their job is to help our body fight sickness and infection by catching germs that come into our body. When the tonsils get full of germs and they stop working well, they're not doing their job, and then we end up getting sick. Lots of times the doctors will say that if we get rid of sick tonsils, the rest of our body will feel better. And I just want to show you, so tonsils are supposed to be pink, and they're pink on everybody. And we have them when we're born. But if they get too full of germs, they end up getting red and big, and they take up too much room in our mouth, and then it becomes hard to breathe, and sometimes it changes our voice. So when they're red, that's when they look infected. They're supposed to be pink. Another part of our body that is a job like the tonsils is called the adenoids. They're behind the stage, so they're too far back to look to see when we look in our mouth. When the adenoids get sick, they get bigger and take up a lot of room in our mouth. If we have big tonsils and big adenoids, they take up a lot of space, and then sometimes it's hard to breathe. When that happens, we breathe loudly in the daytime and we snore at night. But if we take out these parts with all the germs in them, we'll breathe more easily and we'll feel better. Those parts of our body are extra, and we don't need them. There are special doctors who know just the right way to take out our tonsils, since a gazillion kids need to get rid of theirs. Mommy and Daddy called a lot of doctors, and we found the one that we liked best. He will help your mouth and your throat feel better. And that's one of the scripts that I have in the book. We also have a caregiver's organizer and a list of things that you'll need before, during, and after surgery. My son Perry and I, Perry is a medical doctor, and I'm a psychologist, a feelings doctor, or a behavior or a plain doctor. We wrote this book to help families get through the process. We hope it helps you. Thank you so much.